you have to read your patients. Remember, one of those key concepts from Dr. Pankey was know your patient. Well, if we know our patient, we're going to know that you're an I. By the way, the eyes are pretty easy to spot. Can I share some tips on how to recognize the eyes?
Absolutely.
The easiest way is they are the talkers.
Yes.
You ask them, how was your weekend? And you better be careful because they might give you 15 minutes on how their weekend was. And it's wonderful. You sit there listening because it's so fascinating
Yeah.
and it's wonderful. But meanwhile, you just realize we just ran 15 minutes behind. So number one, they are the talkers. Another way you can recognize the eyes, they tend to move quickly in how they move. And even if they're advanced in age, if they're in their 70s, they still move with purpose. You ever notice someone that's in their 70s and they move with purpose, Darren?
Yes, I have.
It's either a D
Yes.
or I. It's either a D or I.
Right.
Because they move with purpose. The S's and C's are way more deliberate. They're
Hmm.
cautious and deliberate. Um, the D's and I's move with purpose. Another way is they tend to be they pay attention to their appearance. The I's. They tend to be very well dressed. And I don't necessarily mean formally or anything, Darren. I mean, you could see a person with a t-shirt, wearing a t-shirt and jeans, and you just look over him and you say, wow, that really looks nice together. So it doesn't have to be formalized, but you
Right.
ever see those people? You say, "Wow, you look really nice today." That's likely to be an I. And they're almost always interested in aesthetics in terms of aesthetic dentistry, whitening, veneers, adult orthodontics, because they want to improve their appearance. Their appearance is part of their reputation, is a part of their calling card. Uh,
Right.
um, another way to say this, and this comes from Dr. Pank, I'll read this passage again. So let's assume that everything has gone very well with this patient. And you might say something like this, and clearly you have rapport and relationship with the patient. So this would not be good if you didn't have rapport and relationship. But if you do have rapport and relationship, you could say something like this. Naren, I sure have appreciated being able to take care of you. Um, if you have any friends, relatives, or neighbors whom you think might benefit from this kind of dental work, please know we'll always make room for them here in our practice. Any friend of yours is a friend of ours.
Right.
Um, and I think what happens, you know, you and I love to study Robert Cialdini.
Yes.
And Robert Cialdini, of course, is the originator of the science of influence.
Right.
And Robert Cialdini talks an awful lot about leverage, meaning you look for the right opportunity to do something like this, to make a request. You don't just randomly, you know, cold, open up a conversation about referrals. But you look for an opportunity. So, if a patient says to you, "Doctor, I am so happy I had this done. I was a little bit concerned because, it required a big investment, required a lot of my time. I was concerned when we started, but I couldn't be happier." There's the opportunity to leverage. And what happens in human nature, Naren, when you're not paying attention, especially in a busy practice especially a busy PPO practice, where we got to pedal like a hamster on the wheel, it's very easy to miss those because we're not present. Make sense?
Absolutely, Gary.
We're
Absolutely.
not present. So we think about, I got to be in two other rooms at the same time. And someone says, gosh, doc, I just want to tell you, I was nervous when I made a commitment to have this treatment done, and it required a big investment, a lot of appointments. But man, I am so thrilled. And a lot of times, what doctors do is they totally miss the cue, put their tail between their legs, and say something like, "Oh, thanks," and they race down the hall,
Yeah.
and they lose
Just
the opportunity.
I agree. And I think if you're dealing with a patient who's not in that 12%, who would, tell their friends and influence and bring in new patients, ask for a Google review, because they would love to write this glowing,
Right.
wonderful Google review for you, right? And that's still very, very, very valuable in 2022.
Very useful.